Hello, welcome to The Voice of Nursing. My name is Adrian Tracy. I'm the CEO of ICG Medical. Very lucky today, joined by a friend of the show, Dr Umesh Prabhu, who's come back to talk to us a little bit about leadership, the workplace relations, and also about our great nurses. Umesh, welcome back.
Thank you very much, Andy. It's a real pleasure to come here.
Fantastic.
I think, as I said, I'm very passionate about NHS. I'm very passionate about nursing colleagues. It's all about working together for the benefit of patients. So it's a pleasure to be here.
Superb. Umesh, obviously we've met before, but for some of the viewers maybe who didn't see the second episode, give us a bit of a background about you joining, the NHS, your background of becoming a doctor, and so on and so forth.
Thank you very much. I had a great career. I came from India in 1982, and I came here because I didn't get my postgraduate seat in India, and I had an amazing career. I developed interest in patient safety after my own mistake in 1982, when a 6-week-old baby developed brain damage. It affects you, somebody's child, your mistake. But there were 7 things went wrong. So that's the time I developed interest in why doctors make mistakes or nurses make mistakes and how to look at the systems. So for the last 30 years, that's all I've done, 25 years. I've done various roles. I was medical director of Berry, then I was NPSA board member, then I became NCAA Advisor for the country. That was one of the best jobs I have done, where I saw tragedy after tragedy for doctors and patients. And I realized vast majority of them are preventable. Nobody comes to work to harm patient. That's a fundamental message I would like to. But each human being makes 5 to 7 mistakes a day. So what we got to do is how to prevent harm to patients. That is fundamentally how I focused on, and went as a medical director Wrightington, Wigan and Leigh in 2010, and we reduced harm by 90%. I didn't do it. It was done by amazing staff of Wrightington, Wigan and Leigh, and I have to say thanks to our amazing nursing staff. They took the courage to come and meet me. Junior doctors came and saw me. It's their courage which transformed. So now I just want to make our NHS safest and the best. We all need safest and the best NHS. So I met many leaders. I met Jeremy Hunt. I was talking to Matt Hancock also. I think we got to make sure we have a fantastic health and social care as we move forward.
I agree entirely. I know one of your big passions is about modern leadership in healthcare.
Absolutely. My passion is leadership. I didn't intend to be leader. Let me be very honest with you. I was very proud when I got the job as a consultant pediatrician in Berry. My father is 92 years old. He lives in a small village. He was extremely proud. But after I made my mistake, I had no choice because I wanted to go back to India. But my mentor in Oxford, with whom I worked, he said, Umesh, no, you owe it to those 2 babies. You have to understand why doctors make mistakes, and you have to see what can be done. That one sentence changed me. So I came back, I headhunted, consulted with my own values, and we developed a very good department. And then I became medical director of Berry, and and that's the reason why. My interest is leadership. I didn't realize what leadership was until I studied Mahatma Gandhi, Nelson Mandela, Martin Luther King. I also studied Saddam Hussein and Hitler. Then I realized the difference between 2 leadership. One who empowers everybody. That is why I'm very keen on nursing empowerment. Nursing staff taking a lot of responsibility. My own example, when my interest was asthma in children, but my waiting time was going up. I had an amazing nurse who wanted to be independent practitioner. So she took 40% of my workload. And she never bothered me. She was much better than me because she knew the devices much better than me. She was very good with children. So I learned a lot from nursing staff. Even as a medical director, it is the nursing staff who took the courage to come and tell me when they were worried about patient safety. And that's the reason why I owe a lot to nursing staff. I owe a lot to junior doctors. And pharmacists, I learned a lot from pharmacists. So it's all about working together for the benefit of patients. That's what leadership is all about.
And talk me through that. You mentioned that the values that you were looking for consultants, they match your own values. Talk about your value chain or what you stand for.
Many people ask me what is value-based leadership. I'm releasing my book about it. You see, that's the reason why we get confused. We get confused with NHS values as our own values. Values is how we treat each other as a human being. Kindness, compassion, respect, listening, valuing. Value is how I value you as a human being, how you value me, or what value I get for the money I spend. So that's the value is what we hold very dear to us. And that is the reason why. It's all about humanity, kindness, compassion, mutual respect. So what we did in Wigan was we identified value-based leaders. These are the people who are very kind, caring, get on with people, good team worker, and one of the best consultants in the department. Because leader is nothing but a role model, whether you are a nurse, whether you are a manager, whether you are a chief executive. When you are a role model, when staff feel valued, when staff feel you listen to them, that is the time where you get best out of your staff.
And I know one of the things you've spoken about, been very, written some articles on, is about bullying in the NHS and bullying culture, and how we can prevent it and how we can look to solve it moving forward.
Bullying has been my interest because I've been accused of bullying. Let me tell you, that was a very good incident where to start off. I had a very good junior doctor, SHO, one of the best junior doctors. She worked very hard for the patients. I never praised her, never thanked her. Somewhere in 1998, one day she made a mistake. I was very upset in front of the family. I told her off. I didn't even realize it was bullying. I was so upset because child had come to harm. That is what happens to many staff, whether it's a senior midwife, senior nurse, or a consultant. They love their patient. They get upset. And in front of everybody, they start shouting. And I shouted at her. I didn't realize. I walked out with anger. That evening, she came to my office and she cried for 1 hour. She taught me the best lesson. She said, Dr. Prabhu, I worked with you for 1 year. You didn't even praise me any day. But today, you made me feel so small in front of the patient and the family. What do they think of me? That one sentence, I realized what I had done to her. So that day I changed my practice. I've always praised and thanked the staff. I've always wrote nice email to our staff on a weekend after the ward round. I wrote nice email to junior doctor. I wish I could clerk like you. I started giving positive message and they remembered that. So let me tell you, bullying is the one which I do not accept at all. I do not tolerate at all. Because bullying undermines human beings. Bullying creates fear. And when staff is afraid to speak up, that is where they don't say anything. I can tell you examples after examples. One particular consultant made a lot of patient wrong diagnosis, and 2 nurses, they knew about it. They took the courage to go and see his colleague. Unfortunately, they bullied them. And these nurses didn't speak to anybody until they took the courage to come and meet me. And that is what I saw, nursing staff taking the courage. Even in Wigan, 70 staff came to see me in confidence. And that is what I wanted. I knew, because bullying takes place nearer where patients are looked after. I gave a lecture to nursing regulation just recently, and I found an article from Australia, Why Nurses Eat Their Young Ones. That title touched my heart and soul. And in that study, 80% of nursing staff said they have observed bullying. 40% of nurses said they have been bullied. I personally feel it is the stress, it is the high expectation. It is because the atmosphere where we work, a patient can die within half an hour. So you want to do the best for your patients. So when something goes wrong, you get upset. Same thing, nursing shortage. We very well know, there's a very good study, tired staff, stressed staff, they start bullying, they start shouting. So what we got to do is we got to completely remove the culture of bullying. We got to support our staff. That is exactly what we did. Happy staff, happy patients. That is the quote which I started. If you want patient to be happy, if you want patient to get the best care, we have to look after our staff very well. Whether it's a nursing staff, junior doctors, senior consultants, we got to completely transform culture of bullying. Let me give statistics. Recently I read 30% of NHS staff feel bullied. 30%. And in my own experience as a medical director, I've seen midwives bullying, I've seen nurses, senior nurses, I've seen consultants bullying. So what we did was we started giving feedback very quickly. Staff came to see me, I used to give feedback. Every month we had a fantastic clinical governance meeting in every department where we started creating positive energy. We always said, look, we come here to do a good job. Let's all work together. Let's care for each other. Let's be kind to each other. And that is how we started giving feedback, and I had to give feedback to probably 10% of the consultants. It's very well known, if you look at Canadian study, if you look at Australian study, New Zealand study, even here, NCAS data or GMC data, 5% of staff at any given time has got disruptive behavior. It's a term used by Americans and Canadians, and that is disruptive behavior. They are very strong-minded people, very good, maybe a surgeon, maybe a pediatrician, very good in the job, but they dominate, and others are very scared. what we got to do is we got to give them feedback early. It's what I call entrenched behavior of intelligent people. It's like you pass the driving test, you start jumping orange light, nobody catches you. You then start jumping the red light. 10 years down the line, you genuinely believe that's the way to drive. And that is the behavior we got to nip it in the bud. And there's a saying in my mother tongue, if you can't bend a plant, you will never bend it when it becomes a tree. So we got to give feedback very early stages, during training. We got to make it a habit. Giving feedback is normal. So I've always asked my own consultants, my own clinical director, guys, give me a feedback, because I'm not perfect. I may shout it sometimes. Somebody has to tell me. Somebody has to tell emperor has no cloth. Otherwise, emperor will walk naked. And that is the habit which we made. That is how we transformed.
Someone told me that one of the areas where feedback was very important, or where feedback was constant, was something like the theatre.
Absolutely.
When you're doing a play or any, a film or whatever it may be, there's constant feedback on what you're doing, how you're doing. It's a constant kind of culture of feedback in that type of environment. And maybe we need to look at some of those arts maybe into how we communicate better with people.
Absolutely. This is what we said. We started off medical director, chief executive, everybody asking feedback. Everybody going around telling the clinical director. I started in the clinical director, ask for feedback. As a surgeon, when you're leading the team, ask for feedback. Give the feedback. Because your staff want to do a good job. They want to feel valued. They want to hear a lot of, and giving a feedback is an art. In Wigan, what I did was, any difficult feedback, I would do it myself. Because you have to do, say, 10 good things. Because you have to win over people's hearts and minds. Even when people say difficult doctor, I've always said I have to understand their difficulty. I had 2 consultants with autism and nobody had diagnosed. And they didn't realize their behavior. Because my interest was autism in children, the moment I saw them, I realized they needed help. And one of them was an amazing cardiologist. And that's the reason why. It's about, we have to understand why people behave the way they do. And if you start giving feedback, if you make it routine, and if you care for each other, I always say, care for the carers. Doctors work very hard, nurses work very hard. Caring every day, 24 hours, takes a lot of energy. It creates a lot of burnout. Doctors and nurses are human beings. They got family problems, they got stress, they got financial problems. What we got to do is completely transform the culture of bullying into kind, caring, compassionate culture.
And I know you've written an article recently in regards to club culture in healthcare.
I realized long time ago. You see, club culture is the way human beings do things. We are born, human beings are born, and we all, birds of same feather flock together. Yep. You see, almost my friends who come to my house is Indians. And that's the reason why. That is what's important. So we create our own club. Club culture is how we do things. And secondly, you see, it's a British culture. To get Clinical Excellence Award, to get OBE, MBE, somebody has to recommend you. You have to get. So you behave that way. That is the problem. So what I've always said is, club culture is the way human beings do things. There's nothing wrong in it. Collaboration is the way we do things, but collusion is bad. Collusion is bad system. Bad leaders is bad for the society. So what we got to do is, in a fair society, everybody is equal. Everybody understands each other. Today, in NHS, there are staff from 118 different countries. So we got different culture, and that is cultural clash we have. What we got to understand each other. Let me give you an example. For example, South Indian staff will not stand up for their right. They will always say, yes sir, no sir, 3 bags full sir. And that's the reason why. Whereas white British culture is an assertive thing. And that's the difference. So we got to understand each other. We got to respect each other. And we got to work together as a team. For a good patient care, you need few things in the departmental level. Number 1 is you need a good leader who is kind, caring, compassionate. Number 2, you need a good team. Number 3, you need a good culture. Because if there's a culture of bullying and people don't get on with each other, patient get the bad care. So these are the basics which we got to get right. So we got to get rid of the culture of bullying. We got to get good culture with the respect for each other, understanding each other, and working together for the benefit of that fellow human being who is our patient.
And is that something you're looking to do around driving that sort of culture of training, that type of thing? Because obviously, as you say, brilliant doctors, brilliant nurses are, the medical side of things. Sometimes they're not trained on the softer skills. That's just not something to do. I know Apollo with Teresa Porritt, she's done some work on that, going, how do they do a business plan, or how are they doing that type of thing?
You hit the nail on the head. My special interest is softer skills. I had to learn myself, and let me tell you, starting off with the nursing stuff. Within a week of coming to this country, a senior nurse, Dorothy, I love her. She said, Dr. Prabhu, you are very rude. And I was shocked. Then she said, you don't say please and thank you. Because in India, please and thank you is a formal language. We don't do it day in and day out, but I realized that is how I have to change. Communication skill, being polite, using the please and thank you. So my special skill is softer skills, assertiveness, inclusion. It's being a nice human being, kindness, how you speak, the language you use, words you use, everything matters to our patients. And it also matters to our colleagues. So I've always said, be good at what you do and be a nice human being. You'll be successful in life.
I agree. I know you mentioned it earlier, but I think a big issue that seems to keep coming up is around the mental health of the actual carers or the caregivers. So as you say, the pressure doctors and nurses are under at the moment is immense, especially with some, they are quite stretched. They're working very long hours. There is obviously challenges at home from financial positions. If you're looking after family, there's a lot going on there.
Mental health is the one we have to give priority. Last year I was stressed. And I have met many consultants who are stressed in my job as a medical director. Stress is extremely common because we work in such an atmosphere which is like a pressure cooker. You got target pressure. You got a patient who is very sick and you have to make the decision very quickly. And you may have a locum agency nurse. So it all precipitates the factor. So mental health, 1 in 4 of us have mental health problem during our lifetime. 1 in 4. It's very high among some professions. For example, politicians, leaders, doctors who have high pressurized job, there is a huge stress. And statistically, as I told you, 30% of staff say they are stressed. For example, if you look at staff grade and associate specialists, nearly 30% of them said they have been bullied or they have seen bullying. So what we got to do is, number one is mental health must be given the priority. We got to understand the reason why they are under pressure. We got to help them, we got to support them. I'm really glad now BMA has taken a lot of initiative on it. I think I saw just one tweet yesterday from the president of BMA, Dinesh Bugra. They are doing a study amongst mental health in doctors. So that is the reason why we got to support them, we got to help them. And secondly, unemployment creates mental health. Disability creates mental health. Poverty creates mental health. So these are all related to each other. I'm really glad this government in yesterday's finance budget, they are given more money for the mental health. We got, and let me use one more statistics. 27 doctors have committed suicide, 87 have died within a year of referral to GMC. And their families suffer. So it's not just the doctor or a nurse suffers, it's the whole family suffers. So we got to make sure, and 90% of these referral to regulator is preventable or unnecessary if you have a good system locally. So I'm glad we are giving a lot of priority for mental health. We got to support our staff, we got to create a kind, compassionate, caring culture, and we got to look after our staff, whether it's a physical health or mental health, and make sure they are fully supported.
I think the big thing on mental health is almost the stigma of it. It's a weakness, and as you say, people at the high end of the profession, like nurses, for them to admit weakness is sometimes difficult, or mistakes, which comes up frequently. They're not infallible. We're only human. And I think it's trying to change that perception of people have problems, but the stigma's got to be, well, then let's help them, as opposed to I've got a mental health issue and oh my goodness, that's kind of it's the stigma attached to it.
It's not just the nurses, even doctors not good at asking for help. I was shocked. Alcohol problems. I had to. Somebody else told me. I had to call the doctor, and he was reluctant to talk. Then when I said, look, I'm here to support you, he opened up. And I had to deal with 3 doctors who had alcohol problem in my job as a medical director. Same thing, drug, substance use, very high in anesthesia, in mental health, consultant psychiatrists. So all of them need help. So what we got to do, we got to understand the reason behind that and help them. And we must make it easy to talk. because it must come from the leaders. It's got a macho culture. That's not going to help our patients. That's not going to help our profession. We've got to make it easy for people to speak up, and when they speak up, we must make sure they have help there.
Well, I think we're seeing quite a lot more in the press army nowadays. You know, it's a bigger issue. I know, so, you know, boxers like Tyson Fury are coming out talking about mental health. You've got the Are You OK program that's come out with, you know, men talking to each other and go, are you OK, and actually asking twice. But also we need to make sure that our nurses, such great caregivers, ask each other if they're OK.
Absolutely. We must empower our nurses, we must empower our staff to speak up, and when they speak up, there must be help available for them.
I agree. And obviously we're seeing, we're talking about the stress that people are under. That's leading to a lot of burnout in the healthcare profession, and this is a, you know, big issue throughout the world at the moment. We're seeing.
Absolutely. I saw recently cardiologists from America talking about burnout. That is, Canadians have done a lot of work on burnout. New Zealand has done a lot of work on burnout, and we got to see what is the reason why our kind and caring staff, there is a huge burnout. And I'm very convinced it's because they feel suffer in silence. They, you know, and bullying culture, they don't feel able to talk. So we got to get rid of all these things and create a kind, caring, compassionate NHS.
And I suppose, you know, I know you've mentioned it before, you know, one of the big issues that we see is some of the communication. And what are your thoughts around some of the communication challenges we have in the healthcare at the moment?
I think two things. I think number one is we got them and us culture, and that is what worries me today. Managers, clinicians, nurses, doctors, psychologists, psychiatrists. I think we got to forget all these things. We are there for only one particular reason, that is our patient. We must put patients at the heart. We must put patient safety at the heart. In Wigan, that is what Chief Executive said, I said. If it's not safe, don't do it. We are here. That one sentence transformed the thinking. And we've always made sure, you said, we did. So leaders' job is to make staff job easy. I always said that. Leaders and managers' job is to make staff job easy. When we all work together for the benefit of the patient, we can have a fantastic NHS.
I know you attended a nursing conference recently.
Yes, I was invited. That was the first thing. I was really enjoyed it because I was invited last minute to talk about nursing regulation, and that's my passion. As you know, as a medical director, I was trained by the best barristers in NCAS and regulation. I've always said, I don't like the word regulation. I personally like to talk about support, help, positive language. So that's the reason why I was telling them, look, 800 nurses have been suspended in 18 months. Is that the way to regulate a profession which is kind and caring? So what we got to do is, number one is, we must provide a lot of support for the staff. We must start giving early feedback, and we got to make sure there is no bullying. And if you do locally all these things, have a good governance, then less and less burnout, less and less talk. But bad doctors, bad nurses must be removed. But that is around 1 to 2% in my experience. Most of them are locums. I was very surprised. If you look at NCAS data, they do provide a good care. Please don't get me wrong. It's not a sweeping generalization. Without locums, I wouldn't have been able to. But because they don't get feedback early, they move from one job to another. They are, if you look at NCAS data, if you look at GMC data, 3 times more risky. That is because they don't get feedback. They don't get support. They don't get money for their continuous education, medical education. All these things we got to look after. In Wigan, we had a very good induction. We focused a lot on induction. Number 2, we had our own agency because we know the staff very well. Those are the things we can do. And agencies, the nursing agency can do a lot. What we got to do is how we are going to support them. Most important, how we are going to give early feedback. We introduce early feedback even for locums. Consultant has to tell me how well they perform, and we would send the positive feedback, most important. When they make mistakes, we also give them the feedback. That is what we got to do. For example, without agency, we will not be able to continue NHS. So there will always be a need for the agency staff. But what we got to do is how we are going to support these nurses, support these doctors.
As I think you say, it does come about agency nurses and doctors. You know, they need to be supported and
Absolutely.
given feedback and treated as a member of staff, as opposed
Absolutely.
to they're separate. You know, they're delivering the patient care as well.
Absolutely, absolutely, and they do provide great care.
Yeah, we work in the modern world. Not everyone's going to sit in the same job for 25 years. That's just not. It's just not.
And the shift system is coming, and the family commitment. Correct. So they want a part-time job. We've got to look at all these things. Most important, how are we going to support our staff to do a good job?
And what would you say the 3 main areas of support that we could look at for the nursing staff?
First and foremost, good induction. Absolutely essential. I used to do workshop for overseas doctors because their need is entirely different. It's a 2 hours workshop, 50 things you must know before you work in NHS. who can support you, who can guide you, who can mentor you, how, don't suffer in silence. Those are the messages I give. How to be a member of defense organization. I was shocked. 40% of doctors appearing before GMC are not members of defense organization.
What's that, sorry?
Defense organization. 40% of doctors appearing before GMC don't have membership of any defense organization.
Right, okay.
Now that's a risk you are taking.
Yeah.
So that's the reason why. So these are the things. Number one is good induction. Number two, early ongoing support for these. When they start making mistake, early feedback. How to be a good team player. How to communicate nicely with the patient. How to get on with human beings, with each other. That's the third thing. Most important third thing, when they make mistake, give early feedback. When we all succeed, the society succeeds. That is what I said. Otherwise, you create them and us culture. In them and us culture, it's always the innocent who suffer, it's our patient who suffer. So we got to give, these are the three important things. Good induction, good support, good early feedback, so that they will not make disaster or serious mistake.
Basically making sure they understand when they're coming into the environment, the expectations, but what happens if, the scenarios, then supporting throughout that, and then when mistakes are made, because we all make mistakes, make sure it's not a blame culture, but more of a, this is how we don't make the same mistake again. Yeah.
Absolutely. Each human being makes 5 to 7 mistakes every day.
Yeah,
so to err is human. What we got to do is make sure patients do not suffer, staff do not suffer because of mistakes. And that is where good system, good process, good early feedback. And let me give you an example. There was a junior doctor who was making mistakes in prescribing. Nobody gave him the feedback. And one day he wrote 10 times insulin, patient developed brain damage. That was preventable because you saw a trend, and that is what we introduced in my own job as a medical director. Any person who makes more than 2 mistakes and doesn't change, I would make it formal. And that time we will have a clear performance improvement targets. And this particular junior doctor should have been trained in prescribing. So we, in medicine prescribing, I was very particular because, as you know, medicine error is the second most common cause of errors in the world. United States, nearly 7,000 patients die. In this country, 400 patients die every year due to medicine mismanagement. And CQC inspection found out a lot of mistakes. So what we did was we had a fantastic system of training for junior doctors. High-risk drugs, for example, warfarin, insulin. These are the very dangerous heparin. These are very dangerous drugs. So what we did was every junior doctor had a fantastic training. Morphine is one more dangerous drug. I have seen quite a few deaths. So you have to have a proper training done by pharmacists, and then the pharmacist is there to support you if you have any question. That is how we reduce medication error. So we got to support our staff. We got to train them very well. We got to make sure they are able to perform very well.
And you mentioned, I know you were always very busy, very active on Twitter and so on and so forth, but I know you spent some time writing a book recently.
Yes, and this is my first book. I'm hoping to write 3 or 4 books. This is my first book, a solo book. So it's about 10 chapters. It's about transformation leadership. It's about Mahatma Gandhi, Nelson Mandela. Where does my values come from? My values come from my grandma. She brought me up at the age of 6 years when I was growing up. She said, always be honest, always be sincere. See good in others, do good to others. Focus only on you, work hard, study hard, keep on improving every day. When you're doing something right, don't be afraid of anybody. These are the core values. These are from Mahatma Gandhi. So that's the reason why my book has got 10 chapters. It's all about how to be a good leader, how to build your resilience, how to develop a good team, how to give feedback early, and how to help fellow human beings to develop. Leader's job is to make everybody a leader, not a follower. So I always have got, and then final chapter is way forward for STP, transformation. So I hope it has got a lot of stories, it has got a lot of quotes. I hope people will enjoy reading it, and I hope people will learn something out of it.
Very good. What's the title?
It's a Transformational Leaders.
Very good. And where's it on Amazon?
We are just finalizing it. I was now with a lot of, fortunately, because in India, I've developed a lot of good relationship. For example, there is a chap known as Dr. Devi Shetty. They do 500 cataract operation a day, 700 cardiac operation a month, and I'm meeting him very soon, so we are hoping to launch it there as well, because as I can tell you a lot of things about India. When people talk about India, I ask them which India are talking about, rich India, middle India or poor India. So now I got a way of helping both the countries. With Brexit we got a very good opportunity. We got a lot of things in common between UK and India. I'm hoping that both the countries will grow together, and this book has got various chapters. It's about values, where it comes from, and how to transform any organization. Simply, happy staff, happy patient.
Good. Is there any other message you'd like to give to our nurses?
I just want to thank our nursing staff, because let me tell you, from the word go I have landed in this country, that's the one thing I learned: valuing, respecting nursing colleagues. Their compassion, their caring, I learned a lot from them. Their courage to come and meet me as a medical director is what actually helped. In 1998, 2 nurses told me about senior surgeon, many patients had died. Doctors had not come to see me. It's a nursing staff, 1998. And then, even in Wigan as a medical director, they took the courage to come and see me. What I really learned, how much they love their patient, the compassion, is a pleasure to watch. And I want to make sure our nurses feel completely empowered. Our nurses are supported fully to speak up. That's the only way we can make patient safety much better in this country.
Super. Umesh, thank you so much for your time today. I really appreciate you coming back in. Looking forward to reading the book. So we'll have to get that on order. Make sure we get a link from Amazon when it's released, and we can get
It's always a pleasure to come here. You got a fantastic staff. You know, one thing I've learned, when there is a staff who smiles, that organization is a good organization. It's a pleasure to come.
Getting there. Thank you so much. Thank you to all our nurses, our doctors, our caregivers, our care assistants. Thank you for looking after us all, and we look forward to seeing you on The Voice of Nursing again soon. Thank you.